Eddie, you got your Razorback tie on?
Yes, sir.
And Dr. Smith has his Razorback mask on. I have our Arkansas mask on today. Welcome to today's COVID-19 daily update. First, I want to just make a comment on the resignation of Secretary Wendy Kelly at the Department of Corrections. She met with me yesterday morning, and she's had a challenging time in some of the personal side of her life, and she submitted her resignation, and it really surprised me, and I express all of my appreciation for her incredible service to the state of Arkansas. And she's really led the institution of corrections with a great deal of heart, caring about the inmates, the people she serves, as well as serving the state of Arkansas. And I just want to express my appreciation to her, and glad that she'll be staying on through July 30th. I'll be making an announcement probably later next week as to how we're going to plan for the succession after her. I also am delighted today to have Secretary Larry Walther with me, and I'm going to talk some about our budget today and in our forecast, and Secretary Walther can answer any technical questions, and some of those might come up afterwards if you have additional information that you need on it. But first of all, it's good news that we will end the fiscal year in Arkansas $360 million ahead of where we thought we were going to be. We revised our revenue forecast down. We have gained in terms of our economy in Arkansas. It did not take the dip that we expected it to, and because of that, we're $360 million ahead. This means that the Revenue Stabilization Act will be filled, and we'll have the public school fund will have $121 million restored. The institutions of higher education will have $42.4 million restored, and they will be fully funded for this fiscal year, including the productivity funding. Secretary Walther will be announcing today that the revenue forecast will be revised, and the revenue forecast will be revised to $5.624 billion. Now, what this means is that in addition to much of Category B being funded because of the increased revenue, public school fund, higher education, it also means that we will be able to restore $72.2 million to the Medicaid Trust Fund. This trust fund had been reduced during the course of the year because of needs and because of cost, and this restoration of the $72.2 million will bring the balance in the trust back to where we started at the beginning of the fiscal year. And as we go into the new year, we'll carry a balance of about $255 million in the Medicaid Trust Fund. This is good news for us. In addition to funding education, meeting the other needs, Medicaid Trust Fund, this still leaves us with a projected $225 million in unallocated reserves as we enter next year. And what it means when we have unallocated reserves is that that will stay in place until the General Assembly meets and allocates that money or decides what to do with that extra unallocated reserve. In addition, just as a reminder, we have in our long-term reserve fund, we still have a balance of approximately $152 million. So that's the financial condition we are in the state as we go into next fiscal year. And as you recall, about a month ago, I believe it was, that I was asked about the merit increase for state employees, and I said it was too uncertain at that moment to indicate a merit increase for our state employees. But now that we see the full financial picture and the condition that we'll be in going into next year, I am today authorizing a merit pay increase for state employees of 2.2%. And so this is a recognition that they've worked very hard, particularly during this pandemic, in delivering state services in the Department of Health, to Workforce Services, Department of Finance, and really in every agency of state government. And so I'm glad, I appreciate their patience, and I think this will be well received. And now let's go to the daily COVID-19 update. Yesterday we had 20,257 cases in Arkansas. Today we have an additional 520 cases. That brings us to 20,777 cases. In terms of hospitalizations, it's good news that we had a decrease in hospitalizations from 300 down to 290, so that's a decrease of 10. In terms of our deaths, we've had an additional 5 Arkansans that have succumbed to this, brings the total deaths to 270. In terms of our cases, the 520 new cases that we had in the last 24 hours, let me give you the top counties. Washington County had 152. Pulaski County had 118. Benton County had 33. Faulkner County 23. Yell County 21. And the rest of the counties were less than 20. Dr. Smith will be commenting more on this. In terms of our testing, we did 4,048 tests. Let's go to the graphs to see it in a different fashion and see the trend line is the reason we show this every day. And again, you can see that we had 5 days of decline. This is a little bit of increase from what we had yesterday, but it is still lower than what we've had over the last week. If you go to the rolling average, you'll see that because we've had a number of days of decline, the rolling average is pointing down. We hope we can keep that downward trend. If you go to the next slide, this is the number of active cases, and you see it flattening a little bit, but clearly it's at the 6,000 mark for active cases. And then the hospitalizations, I believe, is next. And here again, that's the good news that you see the downward trend or downward movement anyway of the hospitalizations. That brings us to a more acceptable number there. It gives some relief to our incredibly dedicated hospital workers. Then the next slide talks about our testing results. We're still way below the 10% positivity rate. We're actually overall, our rate is 6.8%. That's a little bit higher than I like. I'd like to get that positivity rate down. That's a combination of more testing. It's a combination of reducing the spread, quite frankly, of the virus. And then in terms of the cumulative test results, 171,944 for the month. This is the end of the month, so that's it, isn't it?
Oh, we got today's results.
Yeah, so we'll have one more day added to that. So we won't meet next month's goal, but obviously it's been a very significant month for testing. And then we do have one additional slide here on the 7-day rolling average for positivity rate that shows a little bit downward trend. And then we have an admonition, of course, on the next slide, to wear a mask. And so the question is why? This is Mount Rushmore, of course, with the 4th of July picture. This will be one of our ad campaigns during the holiday season, reminding people to wear a mask. And of course, why does Jefferson, Washington, Lincoln, and Roosevelt have their mask on? And the answer is because they could not socially distance. And so a little colorful reminder, hopefully, of the importance of wearing masks. Now, you could argue that there's nobody in front of them, and so they don't need to wear their mask, but they're trying to set a good example. And here today, we wear our mask that's coming in to the press conference, but we have more than 12 feet between ourselves and those that are listening to us. With that, Dr. Smith.
Thank you, Governor. I have my Razorback mask on, matching with Eddie's Razorback tie there. The Governor has mentioned that we did have 520 new cases since yesterday. Of those, 18 were in correctional facilities, at least 18. I'll explain that in just a bit. 502 were in the community, bringing our total to 20,777. Of those, 5,976 are active cases. 120 of those are in nursing home. At least 548 are in correctional facilities, giving us 5,308 active cases in the community. We have had in our nursing homes an additional 11 residents who have tested positive and an additional 8 nursing home staff who have tested positive. We have for the most part, completed our testing of all the long-term care facilities. We still have a few facilities that, for whatever reason, we're not able to do all their testing on their scheduled dates, but we've tested more than 40,000 residents and staff in long-term care facilities. That's been a major undertaking, and we've identified some of these nursing homes, other long-term care facilities with relatively few cases, so we've been able to intervene very rapidly in those cases. The Governor has mentioned that our number currently hospitalized has decreased by 10, so we're at 290. We have 67 who are on ventilators, and that's an increase of 4 from yesterday. And as the Governor mentioned, we've had 5 additional deaths, bringing our total deaths to 270. We have, in terms of recovered, we have 14,531 who have recovered, and that's an increase of 465 from yesterday. The Governor mentioned our testing has gone very well, and we had 4,048 tested yesterday, 171,944 for the month of June so far. The Governor also mentioned our top counties, just to go over those with a little bit more detail. Again, with Washington County being our largest with 152, we are doing targeted testing there. We will continue to make testing available through targeted events so that all the populations within that county have access and will feel comfortable with the venues. So we'll keep testing there. Benton County, we have seen a decrease in cases there. We're down to 33 there. In Pulaski County, of the 118 from yesterday, 44% of those are in Little Rock, and 30% of those are in Wrightsville. And although we don't have complete data on those Wrightsville cases, we think that most or all of those are from the Wrightsville unit, where we've been testing in response to cases there. In Faulkner County, again, it was 23, and Yell County, 21. I want to make a few additional comments. First of all, we have our CDC team is continuing to work in the northwest part of the state. They are beginning to prepare their written report for us, and hopefully we'll have something within the next week. We actually have a second CDC team that has joined us this week, focusing on better describing transmission of COVID-19 in nursing homes. And Arkansas has been selected as a state to do that, I think because of our very good partnership with the nursing homes, and hopefully we will learn additional information about how COVID-19 spreads in nursing homes, and that will be information that will help us in our response, but also will help other states as well. I want to mention large venue plans. As we're looking ahead to the 4th of July holiday, there are large venue plans that are submitted to the Arkansas Department of Health, and they're approved. And those plans are designed to make those events as safe as possible, to limit COVID-19 transmission as much as possible. But a plan is only as good as its implementation, and I want to give that as a message. If you come to a large venue and then you don't follow the instructions of the organizers, especially with regard to masks, then that plan isn't going to work. It's not going to keep people safe. It's very important when you come to a large venue that you wear a mask, especially if it's an inside venue. Outside is safer, but inside it's particularly important to have those, to wear the masks and to maintain that physical distancing. And how we wear a mask is important as well. I think our presidents on Mount Rushmore set a good example. The mask was not only covering the mouth, but also the nose, as I see you all are doing here. And I congratulate you on that, because I've gone to various places and seen people wearing that mask below the nose. And the way that these cloth masks work is to capture the respiratory droplets in our breath. Now, if you're breathing over the mask, well, that mask is not working. So it's important that those masks cover the nose so that they capture the respiratory droplets from the breath so that they're not released into the air for other people to breathe. The last thing that I wanted to talk about is just preparing for 4th of July. Think about your plans and how to enjoy other people, enjoy the holiday, but plan ahead to make sure that you're able to do that in a safe fashion. Like our presidents on Mount Rushmore, they're there, they're celebrating the 4th of July, but they're doing it safely. With that, I'll turn it back over to the governor.
Thank you, Dr. Smith, and we'll take questions.
Are you ruling out changing the forecast for fiscal 21?
Well, you never know what the entire year will play out, but there's no anticipation of revising the forecast for next year. I expect that July could be a down month just because it looks like individuals paid their taxes more on time, and so it was extended July 15th, and so that could be, we expected more revenue then. That could be down, but we don't intend to revise the forecast because with the way our economy is moving, I'm hopeful that we'll be able to stick with that throughout the year. Yes?
The Little Rock School District put out a frequently asked questions things today, and indicating that they will require masks, students to wear masks. I need to do this. Students to wear masks on school buses, and but they said that more masking, that the issue's continuing to evolve, and so if the Little Rock School District decides that children should wear masks in school, as they are debating, is that something that the state would want to intervene in to stop? Or,
no, of course not. This is something that the school districts by design are having flexibility as to how they're going to manage in classroom instruction and the transportation issues. Obviously, the public health guidelines, and I'll ask Dr. Smith to talk about children and masks, but as long as they're following those guidelines, then we want to have the flexibility to what works with the parents, what works with the school districts.
There's two aspects of this with children and masks, at least two aspects. One is whether children will wear them and keep them on, and that's always a question, although I think that children tend to surprise us adults by being more flexible and adaptable than we are, and learning to wear a mask will be a survival skill for our children, at least in the near future. And so, you know, they may do better than we expect. They may actually do better than we do. The other aspect is how transmissible is COVID-19 in a school setting, and you know, we have limited data on that at this point. We do know that there are situations in which COVID-19 has been transmitted, for example, from a teacher to students. But you know, how much it's transmitted between students is still an open question. We do know that with regard to COVID-19, children are not the same as adults, and we're learning more about that. And Dr. Jose Romero, our Chief Medical Officer and soon-to-be interim Secretary of Health, is a pediatric infectious disease specialist and is monitoring those new findings, and we will apply those to the school setting as we get closer to that time.
Is it possible to apply them statewide rather than district by district, or?
Well, each school and each district has some unique features, but the principals, certainly we will make sure that they are incorporated, that they have that information available in making their plans.
Are we still seeing that 0 to 17 age group growing? I know about a week and a half ago, it was probably one of the bigger categories in terms of growth.
They are still increasing in that group, but it's really the 18 to 25-year-old group that is the leading one right now, and we'll be continuing to monitor that.
Alex?
Last week you said it seemed as though cases in Northwest Arkansas were leveling out. What do you say now with these new cases in Washington County, and why they're not leveling out like you hoped?
Well, I think they are, and so I think that trend is continuing. If you look at Benton County, it's clearly going down. Washington County has been going down. Today is an uptick in the case there. And of course, and so I think you have seen that progress. I was pleased in talking to one hospital up there that they even saw some leveling out. And so we'll see where it goes from here. It's obviously worrisome when you have, the number of cases today in Washington County. But overall, in the last 7 days, I think it showed some progress there.
Do you know where everything's coming from here in the Pulaski County area, or is it just sort of all over the place? Because I know yesterday you mentioned that we're not seeing specific clusters.
Oh, go ahead.
What I can tell you right now is that almost a third of them are coming from Wrightsville, and we think that those are probably most, if not all of them, are from the Wrightsville unit.
What about the other 2/3 of it then?
Well, 44% are in Little Rock, but we don't have information on specific outbreaks yet. Of course, these are just new reports from this morning.
Is there any question remotely?
Yes, this is Melissa Zigowitz with THB 11. When you look at other states that have required masks for at least 2 months now, New York and Illinois, for example, these are also one of the few states not experiencing a second outbreak. On Sunday, New York logged less than 400 cases, and Illinois has one of the fastest declining positivity rates in the country. Now, Governor Cuomo is now calling on the president to mandate all Americans to wear masks because it's working. Now, my question is, have you spoken to any of these governors to get their perspective on how it's working and how they're enforcing it?
Yes, and you did mention a couple of states, but how about California? California has had some of the strictest rules, and you see their cases going up. So I think you can continue to look at the data. As I talk to other governors, the majority of governors have not provided any mandates, statewide mandates for wearing masks. But more importantly, I talk to Arkansans, and I look at the data here, and we've seen a significant increase in wearing masks based upon our strategy of education, of leadership, of encouragement, and showing the difference that it makes. And that has increased the usage of face coverings when you can't do social distancing. So we drive that message. I think you're seeing success in it, and we're going to continue to do so. Another question remotely?
Yes, Governor, this is Garrett Ferguson with KNWA Fox 24 News in Fayetteville. Are you still looking at moving forward with the nursing homes reopening, planning starting tomorrow? The Washington County coroner has voiced his concern about nursing homes reopening, especially here in Washington County with the number of cases increasing. Are you looking at that reopening again?
If the nursing homes meet the criteria that we set and that CDC guidelines, then we go ahead and plan on continuing to reopen them to allow visitors with the restrictions and guidelines that have been set. It looks like probably about, I think a majority of the nursing homes will be subject to that reopening. but there will be a significant number that will not meet the criteria because they've had a positive test, and the new CDC guidelines provides that to reopen a nursing home, there should be 28 days without a positive case. And so we will be following that guideline as part of the direction to the nursing homes as they try to open up visitors to the loved ones. And Dr. Smith, did you want to add to that?
As the governor stated, that is the major change, is to, if there's been even one case amongst either a resident or a staff member, then the CMS guidelines are to wait 28 days before allowing visitors. And that's different than what we had put forth, but we are incorporating that in just to be consistent with our federal colleagues and also out of an abundance of caution. I know that that is going to exclude some of the nursing homes from allowing visitors that had hoped to, and they'll just have to wait longer. To give you some perspective, as of yesterday, we had tested over 40,000 residents and staff in long-term care facilities. We have results on 326, and of those, as of yesterday, we had 59 that had at least one case amongst a staff member or a resident. And so, for example, those 59 will have to wait 28 days until they, until they don't have any additional positive cases. But there are still the majority that don't have any cases, and they will be able to, under the limitations that we put in our guidance, will be able to start allowing visitors.
Alex?
How many of the contact tracing investigations are unable to find a source?
The contact the contact tracing is actually looking for contacts, and there are some times where there are no contacts. Someone didn't have any contacts during their infectious period. If you're talking about the case investigations, trying to find where that person became infected, we have had, it's running around 25%, about a quarter of those we've not been able to link them with a particular exposure. We're trying to work to reduce that, but that's where we are right now.
Yes.
If the state of Arkansas sees a significant increase in the number of new cases, would you consider implementing a statewide mask order to wear masks versus shutting down again?
Well, we'll consider anything that is supported by good science and information and that we believe will work. Of course, when you look statewide, there are still one or more counties that have 0 cases. There's others that might have 1 active case. And so, for a lot of different reasons, I don't think that is right. So we'll look at the data. If we need to make adjustments, we will, but I don't expect that to happen in the near future.
Maybe, and I know it's maybe getting ahead of here, but when can we expect a contact sport directive? Because I'm ready to ball just as much as you are.
Well, that's right, and let me just add to that it appears to me that there's some of our athletes that are in summer sports that are going to Oklahoma and Texas. And I don't know how they're doing that, but it seems that they're playing with their guidelines maybe a little bit looser in some of the other states. But I'm anxious to play. We'll continue to look at that. But because we have it on pause right now, and until we get these cases down, then I don't expect the movement to take place for going to a phase 3 or for opening it up for those additional contact sports. I'm anxious for that to change, and hopefully we'll get there if we all do our duty and do our responsibility. And I do get messages from people that say, whatever it takes, let's do it so we can get to sports next year. We want to do that, but we got to be smart, and we got to get this under control. Alex.
Will the Department of Health be releasing a specific directive for schools? And if so, when can we expect that?
A specific directive for schools? Well, we already are working very closely with the Department of Health and Department of Education that came up with the blended learning environment and the guidance that is being put out. They'll continue to work together. Do you have any more specific on that, Dr. Smith? Yeah, it's the Ready to Learn. That is the guidelines of the Department of Health with the Department of Education combined. So anything you see coming out of the Department of Education with the schools will be in partnership with the Department of Health and with their blessing. Maybe a couple more questions.
On the contact tracing contact.
The contact tracing contract. Dr. Smith, what's the latest on that? Are we moving on that?
We've selected the number one, and then as we get...
well, you're going to have to come to the microphone.
We have selected the number one from among our choices, and then as soon as we're able to get the additional funding and authorization for that funding, we'll go ahead and specify the number two. So we'll have two contracts for contact tracing, and that will, initially we want to move as quickly as possible with the first one because we already have the funding and authorization for that. That will add 350 to our army of contact tracers, and then when the other one, assuming we're able to get the funding and authorization, that will bring on another 350. So we'll have 700 additional contact tracers to supplement our workforce.
So that first contract, how soon are they going to be able to start working?
They're supposed to start as soon as possible, and hopefully have some activity going on even this week.
Secretary Kelly, 2 weeks ago, she had told one of the legislative committees that she had asked for the budget cut in fiscal 22 to her agency to be restored, and that was rejected. Was there any disagreements on budgets that was behind her retirement?
There was absolutely no disagreement in policy and direction and coordinating. So that I was as surprised as anyone yesterday with her coming to me and indicating she's submitting a resignation, and I accept her reasons at face value. But Secretary Walther might be able to dig in and learn a little bit more about that, which is a surprise to me. All right, yes.
Something non-COVID related here. I guess with the Medical Marijuana Commission kind of having some drama the past couple of weeks, do you have a stance one way or the other on the potential of issuing those last two cultivation licenses, or?
I know that they're meeting, and that's a decision that the Marijuana Commission must make as to whether to grant any additional cultivation licenses. To me, the most important criteria is whether there is a need for a greater supply. If there's not a need for a greater supply, then there should not be the licenses issued. If there is a need for a greater supply to meet the need of patients, then that is something that should lead to the granting of licenses. And so that's a decision that they make, but I trust that they will make it based upon that data as to what the needs are out there of the patients in terms of the supply. Thank you all very much.